CBS News reporter Alex Alexanderton, I sometimes say Alex, forgive me, Alexander, joins me now with the latest on COVID-19. Alex Alexander, they're all interchangeable. So, Omicron subvariants, we know them as BA.4, BA.5, now account, according to all the reporting you do for us on a daily basis, for more than 9 of 10 new COVID infections. What can you tell us about that phenomenon and the pursuit of a vaccine tailored to these particular variants?
Yeah, well, you'll recall that the FDA said just last month that they had decided after a meeting of their outside vaccine advisors that the next generation of COVID vaccine boosters for this fall should be targeted not just at the Omicron variant, but should include a component of the Omicron variant targeted at BA.4 and BA.5, which at the time they predicted, and we now know, was going to become the dominant strain here in the United States. Now, with that said, if you think about that timeline, the White House doesn't expect the first of the BA.4, BA.5 boosters to come around town until October, and those will be just the first batches. The vaccine manufacturers have only started now ramping up production of those vaccines, so real full-scale, full-steam rollouts of those BA.4, BA.5 vaccines won't come until the winter. By that time, we'll probably be seeing another variant that isn't BA.4, BA.5. But again, the FDA said at the time that of all of the options they had, hopefully BA.4 and BA.5 vaccines will widen that coverage, will broaden that coverage in the best way possible of all of the options they had in anticipation of whatever we might be facing come this winter.
And of course, it's worth reminding ourselves that vaccines are not necessarily designed to make sure you never get the virus, but that if you do, that your symptoms are more manageable than if you didn't. But digging in on these two subvariants, BA.4, BA.5, a little bit more, are we seeing significant changes right now in the U.S. in the numbers of deaths or hospitalizations?
Well, here's the situation, right? If you look, for example, let's take deaths first. If you look at the number of COVID-19 deaths we've been seeing on average per day around the country, we've been averaging somewhere between 300 to 350 COVID-19 deaths for many weeks now. That is not as low as some people would have hoped. That's probably not as low as policymakers and leaders, including at the White House, wish the number of COVID-19 deaths was. But it's also a fraction of the heights that we saw during the last 2 winter surges that you'll recall. To put that number in context, though, when you look at the regional level, it doesn't look steady at all. You know, you see some regions that have seen these big surges in COVID-19 deaths now slowing down, and you're seeing other places like the Pacific Northwest right now that are seeing COVID-19 deaths double and triple from what they were just a few months ago. So, with that in mind, let's look at hospitalizations now. Hospitalizations are also much higher than they were at this time last year. They're much higher than they were a couple weeks, a couple months ago. But they're obviously also still far lower than those peaks we saw during the past 2 waves. There's an additional wrinkle when you're thinking about hospitalization numbers. The CDC and federal health officials also track things like ICU capacity. That's the number of those patients who have COVID-19 who are taking up space in those most critical care beds in hospitals. ICU capacity is actually pretty good right now compared to those past 2 surges. No region around the country is above 8%, which again, just to put that in context, is much better than we saw during some of the previous waves. So it's a mixed picture. Deaths aren't as low as we might hope, as policymakers might hope. Hospitalizations aren't as low, but they also aren't as bad as they were this past winter.
Super important context, Alexander. Thank you so much for that. So people know anecdotally, and the data reflect this, that people are contracting the virus for a second and a third time. Are some people, generally speaking, at a higher risk of reinfection than others?
Yeah, I mean, it's a complicated question, right? It depends on a whole bunch of factors, right? But the biggest 2 factors that I think most people think about. The first one is, if you were infected with COVID-19 and you survived, what variant that was that caused your first infection. That matters because, for example, when you're thinking about the BA.4 and BA.5 variants, we have some data now to suggest that if you got infected and survived with the other Omicron variant we saw during the winter, BA.1, that you might actually have not as good protection as somebody who, for example, survived the Beta variant or the Delta variant. But that's not including the fact that, immune responses wane over time, just like we know from the vaccines. depending on how recently you were boosted, that plays a big factor into how good is the protection that you have from those vaccines. That's part of the reason why you're hearing all of this talk now about the potential for rolling out second boosters for people under the age of 50 years old broadly, as opposed to just those older and high-risk groups, and why you're also hearing all of this talk about studies that now suggest people with a first booster who are eligible for that second booster should get it. Because we have data now to suggest that after just 3 months after getting that booster, you see a substantial decline in that kind of immune response. Those are all of the kinds of, very complicated factors that go into one individual person wondering, how did I get reinfected with COVID-19 in just a few weeks?
Ladies and gentlemen, every day we rely on Alexander Tin to understand this story. You can see why. Alexander, thanks so much.
Thank you.